Bismillahirrahmanirrahim. Today we are going to learn about some basic terminologies in the formation of urine, which we have come across in the previous lecture. The first one is nephrology versus urology. Nephrology, the scientific study of anatomy, physiology, and pathology of the kidney, while the nephrologist is the non-surgical expert of medicine of kidney. So the nephrologist is a man who is expert in the medicine of kidney, who is only expert in the medicine of kidney, not the reproductive system. He has nothing to do with the reproductive system, and he has nothing to do with the surgery. The second one is urology, the branch of medicine that deals with the male and female urinary system, and the male reproductive system is called urology. While the urologist is a man who is surgical expert in the medicine of urinary tract, as the definition explain that the urologist is expert in the urinary system of both male and female, while he is also expert in the uh, reproductive system of only male. He is expert in the urinary system of both male and female, while he is expert in the reproductive system of only male. Why he is expert in the reproductive system of only male? Because the reproductive system of male come across the urinary tract. uh, Actually, he is surgical expert in the medicine of urinary tract. So the reproductive system of male already come across the urinary tract. That is why he is a surgical expert in the reproductive system of male, while the person who is expert in the reproductive system of female, that is a different terminology that is called gynecology or gynecologist. So the urologist must be a surgeon, while the nephrologist must not be the surgeon. Nephrologist will never be a surgeon. He will not be expert in surgery, while the urologist is expert in surgery also. The second terminology is cortical nephron versus juxta-medullary nephron. The cortical nephrons, as the name indicate, are those nephrons which are located in the cortex region of the kidney, while the juxta-medullary nephron are those nephrons which are majorly located in the medulla region of the kidney. These are called juxta-medullary nephron because juxta means junction, junction of the medulla. The nephron whose corpuscle and convoluted tubule are uh, present at the junction of the medulla and cortex. The nephron whose corpuscle and convoluted tubule are present at the junction of the medulla and cortex, or you can simply say that those nephron whose corpuscle are located at the junction of near the junction of the medulla and cortex of kidney. Those are called juxtamedullary nephron, and the nephron which are majorly present in the cortex region, and whose major portion is located in the cortex, and small portion of this is located in the medulla region, that is called cortical nephron. In the kidney, about 15% of the nephron are juxtamedullary nephron, while the 85% of nephron are the cortical nephron. A very important nephron is the juxtamedullary nephron, which is responsible for the formation of urine as well as the osmoregulation. While this is responsible only for the formation of urine, this is not responsible for the osmoregulation. Osmoregulation of the kidney, not osmoregulation of the body. This is also responsible for the osmoregulation of the body, but this is not responsible for osmoregulation of the kidney. This is responsible for the osmoregulation of the kidney. It develop the osmotic gradient in the medulla. It provide the concentrated fluid to the medulla. This nephron provide the concentrated fluid to the medulla, and this do not provide the concentrated fluid to the medulla. As we know that the osmotic pressure or osmolarity increases by coming down through the kidney from the cortex to medulla. As we come down, the osmotic pressure increases. As we go up, the osmotic pressure decreases. So this increase in the osmotic pressure is due to the presence of the juxta-medullary nephron inside the kidney. So the next one is obligatory reabsorption versus facultative reabsorption. Obligatory reabsorption, as the name indicate, obligatory or obligation, that mean must. For example, obligatory task, the task which should must be carried out, that is called obligatory task. For example, obligatory prayer, the prayer which must be performed, the prayer which must be offered. For example, we normally say prayer, we Muslim say 5 obligatory prayer per day. We say 5 obligatory prayer per day, or we offer 5 obligatory prayer per day. Because these are obligatory, these are must, these are farz namaz are called obligatory prayer, while those prayer which are not farz are called nafal namaz. So the obligatory reabsorption is the reabsorption which should must be reabsorbed, which should must be there. The obligatory reabsorption are the reabsorption which do not change with the change in condition, which do not change with the change in environment, which is irrespective of the water balance in the body. For example, as the new definition indicate, about 85% of the filtered water is always reabsorbed, and which is irrespective of body balance, water balance. About 85% of the water reabsorbed in the from this portion to this portion. 85% of the water is reabsorbed, that should be absorbed, that should must be absorbed irrespective of the external environment, irrespective of the conditions of the body. That should must be absorbed, that is 85% of the reabsorption of water. This is obligatory reabsorption. They do not depend upon the body, the presence of water in the body. This reabsorption occur by osmosis in response to transtubular. It actually uh, take place due to the osmotic gradient, due to osmotic difference in the interstitial fluid over here, between the tubule and the interstitial fluid. The difference between the tubule and an interstitial fluid allow this obligatory reabsorption, and there should must be difference between the interstitial fluid, the osmolarity of the osmolarity of the tubule and the interstitial fluid. So this is obligatory reabsorption. 85% of the water absorption is obligatory, while the facultative reabsorption, first of all, I would like to explain this word facultative. Facultative, now, for example, if we go in detail, there are two types of micro. For example, I'm going to discuss a microbiology example over here. That there are two types of microbe. One is facultative aerobes and obligatory aerobes. Facultative aerobes are those microbe who the first of all, obligatory aerobes are those microbes who who should must need oxygen for their survival, which need oxygen for their survival, for which the presence of oxygen should must be there. If there is decrease in the level of oxygen, or if there is absence of oxygen, those microbes will die. The obligatory aerobes are those aerobes which need oxygen, which must need oxygen for their survival, while the facultative aerobes are those which can live, which have the ability to live without the presence of oxygen. The facultative mean which can modify itself, which can change itself by the changing condition. So facultative reabsorption is the reabsorption which can be modified, which can be changed with the condition of the body, which can be changed with the presence of the water molecule inside the body. So the remaining 15 to 18% of the water may or may not be absorbed depending upon the water balance. It is called facultative reabsorption. If the water is present in large amount in the body, then there is no need to reabsorb the water. There is no need to secrete the ADH, antidiuretic hormone. So there is no need to reabsorb water because our body is having large amount of water already. So that is a facultative, that is facultative reabsorption. That is but if there is no water in the body, for example in Ramadan, we need some amount of body in the day, some amount of water in the body, and the amount of water in the body decreases as the time goes near the Aftari. So what will happen in the evening during the fasting condition in the Ramadan in the evening? What will happen? The secretion of large amount of ADH will be there. There will be large amount of ADH secretion. What will ADH do? ADH will act on this collecting duct. ADH will act on this collecting duct. By acting on collecting duct, the ADH adds some aquaporine, uh, some channels over here. Those channels are responsible for the reabsorption of water, So if the amount of water inside the body decreases, the facultative reabsorption increases. The ADH, the release of hormone ADH increases, so it increases the reabsorption of water. So this is what we call the facultative reabsorption. Facultative reabsorption change with the change in condition, while the obligatory reabsorption do not change by change in condition. The last one, this definition deals with the difference between the peritubular capillaries versus Vasa recta. Capillaries, as the diagram indicate, these are peritubular capillaries. These are All of these are peritubular capillaries. Those capillaries which are around the convoluted tubule. Now, those capillaries which are all around the convoluted tubule, intermingled around the convoluted tubule, those are called peritubular capillaries. Now, while the Vasa recta are those blood vessels which come alongside of the loop of Henle and ascending and descending limb. Those blood vessels which are thin in diameter, these are not thin in diameter. These are the diameter different. There is difference between the diameter of Vasa recta. This is Vasa recta, and this is peritubular capillary, are peritubular blood vessel. The peritubular capillaries is having a bit larger diameter than the Vasa recta. This is Vasa recta is having smaller diameter. The Vasa recta are those blood vessels which are all around the descending and ascending limb, as well as the loop of Henle. The Vasa recta is normally absent in the cortical neuron and present in the juxta-medullary nephron, but this is not absolute definition. The Vasa recta may also be present in the cortical nephron. Some cortical nephron may also contain the Vasa recta, but majority of the nephron in the cortical region do not contain Vasa recta, and the majority of nephron in the medulla contain Vasa recta. The almost all the juxtamedullary nephron contain Vasa recta, while some percent of the some less than 1% of the cortical nephron also contain Vasa recta, and the Vasa recta is responsible for the reabsorption of water, and this is also responsible for the formation of concentrated urine, and this is also responsible for the development of osmotic gradient. The Vasa recta is smaller in diameter because and what is the logic behind this small diameter? Because to allow the blood flow in the small speed, it allow the very low speed of blood, it allow the flow of blood in very slow manner. This slow manner flow of blood provide provide opportunity to the interstitial fluid to develop high osmotic pressure, and that high osmotic pressure is responsible for the for the reabsorption of water from this area. So this was all about today's terminologies.